Hi, I'm here to discuss some of the risks to treatment with braces or orthodontic treatment today. Um, Obviously, what we want is a lovely result from braces that you get, nice straight white teeth. But unfortunately, as with most things in life, there are some risks involved in that, and I need to cover those with you. So, the first one is, I think, a rather strange one, and I need to show you a picture of this to explain it. But it's something we call root resorption, where by moving the teeth, the roots of the teeth are slightly shortened. Now, this actually happened to my teeth when I had braces as a teenager. I had them on for about 3 years, and on x-rays you can see that the roots of my teeth are slightly shortened. I don't feel any different, they don't look any different, and it shouldn't cause me any problems in life, except if I suffer gum disease later in life. The roots are shorter. If you lose bone, you'll get to the end of the tooth faster and the tooth will fall out quicker. Um, Another thing with fixed braces that's vitally important is cleaning your teeth well enough. If you don't, then you can get a buildup of plaque around, firstly, the brackets of the teeth and along the gums, and it can cause the gums to become inflamed and swollen, and it can cause permanent marks around the brackets of the teeth that can be a white or a brown color. Obviously, we don't want these. It is difficult to clean your teeth with braces on, so you have my sympathy, but you've got to work hard at cleaning them, and we'll help advise you on how to do that. And another thing that's important to point out right from the start is that your teeth will move again once we take the braces off if we're not careful, and maybe even if we are careful. So we will always make you retainers to hold the teeth in place. Sometimes we'll put a fixed retainer at the back of the teeth as well, but we will always give you a nighttime retainer that you wear, a little plastic guard that you put over your teeth at night, and you must wear that to hold the teeth in position. um, a little bit difficult to get into the habit of it, but I generally find that most people, once they're in the habit of that, you know, have no problem doing that. But it's an ongoing thing. You do need to keep doing that, and although you may not be doing it every night, in years to come, you certainly always need to have a retainer that you can put in. You can check the teeth aren't moving, and you can use to hold the teeth into position. Um, And as far as any other risks go, there's always a risk of upsetting a tooth that has a nerve that's especially a nerve that's already traumatized, or that has been traumatized by maybe some damage to it, deep fillings, things like that. Um, Sometimes by moving that tooth, you can upset that nerve and cause it to flare up, and then that tooth will become painful, maybe even needing a root canal. Doesn't happen very often. I can honestly say I think it's happened once in all the time I've done braces, but that is a risk that you take, and we will X-ray your teeth before we start any treatment to check what the nerves look like and what the roots look like, and try and make sure that we're not going to cause any damage and we won't move any teeth that we think are at risk. Another risk that I like to show people visually is something we call black triangles, and this is where once we align the teeth, you can see a space. Now, sometimes when the teeth are crossed over, you can't see that space. Once we get the teeth lined up, a space becomes noticeable there. Obviously, people don't like the look of that, and so here it shows you how you can get that space filled in with some resin. It's difficult to prevent it happening. It's just the natural shape of the teeth that causes that. Sometimes we'll flatten off the edges of the teeth to try and bring them closer together and prevent that. But again, it's a risk we take when we straighten teeth that you're left with something like that. But it can be fixed. One of the other risks that I like to cover, or this isn't a risk as much as a treatment that we may need to do for your teeth, and we don't do this for everyone, but sometimes if we need to make some space and we want to avoid extracting teeth to make that space, then we'll shave a little bit off the teeth. As I said with the black triangles, sometimes we'll do this to try and prevent that happening, but sometimes we just need space, and we will take a minimal amount, no more than 0.5 of a millimeter between two teeth, so that's 0.25 of a millimeter off the side of either of the teeth. And that doesn't, that means that the teeth aren't more prone to decay or problems in the future. But I understand that not everyone likes the idea of having to do some permanent change to a tooth. So so we will discuss this with you. If it's something you want to avoid, then it can be avoided. The teeth will then have to be a little further forward to make the space to get them to line up, and that means a bit more risk of gum recession. And gum recession is a risk with braces. Again, I've got a little bit of it from when I had braces, and just moving the teeth about, especially if we're having to bring teeth further out to get them in line and looking nice. Sometimes that means that the gum and the bone don't cover the tooth as much as they used to, and the gum might recede a little higher. Usually, again, not a permanent problem, but some people obviously don't like the look of that. Often it doesn't show, but if it does, obviously that can be quite anesthetic, and it can make the teeth more sensitive. Again, something we can deal with sensitive toothpaste and treatments, but something we do our best to avoid as well. So I think that covers it for the risks involved. I'll discuss them all with you more thoroughly in our face-to-face appointment. But I hope that gives you a flavour of things.